Hey guys, it's Dr. Cassie back with another podcast full of great information about helping itchy pets. In this podcast, sponsored in part by Zoetis, Dr. Jay Chrisman will talk to us about how to make discussions about itchy pets part of all wellness exams and give us some of his tips for success in treating these pets. And now is the perfect time to be talking about this because August is Itchy Pet Awareness Month. So first, let me tell you a little bit about my guest. Dr. Chrisman believes that veterinary practice is a team sport and that it should be fulfilling, profitable, and fun. Dr. Chrisman, I couldn't agree more. He graduated from Auburn University in 1991 with a degree in animal and dairy science and earned his DVM from Auburn in 1995. He then completed a 2-year rotating internship in Las Vegas before returning home to serve as medical director at Double Oak Mountain Animal Hospital for 9 years. After that, he became a professional services veterinarian for Zoetis, receiving extensive continuing education and training while working with veterinarians all over the United States. He returned to private practice in 2013 and is the proud owner of an award-winning companion animal practice in Alabama. Drawing on his more than 24 years of veterinary experience, he's developed approaches to help veterinary professionals adapt and thrive in ever-changing market conditions. He is passionate about excellence in patient care and the client experience. Favorite areas of practice include surgery, dermatology, and preventative care. Even though he's a full-time practitioner, he also makes time to consult with colleagues and provide guest lectures all over the country. And we're so happy he's made time to be here with us for this podcast. Dr. Chrisman, let me go ahead and turn it over to you.
Thank you, Dr. Cassie, for the introduction. Hi, everybody. I'm coming to you with exciting news today about the number one reason dogs come to see us in our veterinary practices: itch. Did you know that 20 million American households have a dog with pruritus? And sadly, 45% of those dogs do not get to go to the vet for relief. Well, why is that? A lot of pet owners simply do not recognize itch as abnormal. Hey, dogs just itch, right? No. Or worse yet, they may think there's nothing that can be done about the problem. Most pet owners treat at home with over-the-counter stuff like antihistamines and topicals. They use things they read about on the internet. The bottom line is that most of those approaches just don't work very well, if at all. So we have a huge opportunity as veterinarians to help these pets and their people. Here's the big announcement. August is Itchy Pet Awareness Month. So what is Itchy Pet Awareness Month, you may ask? It's an effort launched by Zoetis to encourage pet owners and veterinarians to engage in a conversation about itchy behavior and raise awareness of pet skin health issues and needs. Skin-related issues are the top 4 reasons that pet owners bring their dogs to see us in the first place. That includes skin allergies, skin infections, skin lumps, bumps, and skin infections. Last year, August 2019, was the inaugural Itchy Pet Awareness Month. It sparked record-breaking numbers for a single month in veterinary dermatology. August 2019 saw the highest number of dermatology visits ever and the highest revenue on record by people who track those things. Most importantly, that represents a lot of itchy dogs that got much-needed relief from itching and scratching. The timing is perfect for Itchy Pet Awareness Month 2020. We're at the peak of the allergy season, and due to the pandemic, people are at home more than ever before interacting with and observing their pets. Despite all the distraction that COVID's brought to our lives, veterinary visits are up in most areas of the country. Itchy Pet Month's an idea that, in my opinion, was long overdue. In my practice here in Alabama, we see a lot of skin cases, and with all modesty, we're pretty darn good. But prior to last year, we never really made any special efforts to emphasize dermatology. We talked to owners of at-risk breeds, but mostly we just took good care of cases as they came in. So that's exactly what I want to talk with you about during our time together today. How to take advantage of Itchy Pet Month 2020 to emphasize dermatology, to enhance the level of care you provide your patients, and to grow your practice. There are 3 key points to make that happen. First, include itch and attention to skin health as part of every single wellness or preventive care exam. Make skin part of the history taking, or at least include it on an intake form. Ask questions like, hey, how's your skin? Tell me about any scratching, rubbing, paw licking, or chewing that you might see at home. Make skin an active part of the exam. Don't miss redness in the ears, between the toes, on the belly, armpits. Notice areas of thin coat, odor, other abnormalities. Second, recognize how critically important that first itch visit really is. Pet owners come to see us for real relief, and they want it fast. By the time they make it to us and they're in to see the veterinarian, 88% of pet owners have already tried at-home treatments. That did not work. Let me say it again, that did not work. That's why they're in to see us. Some may have even been in to see another veterinarian who didn't take the time to really explain and teach them about allergic disease. We often have frustrated and disappointed people on our hands. Now it's our time to shine. So I encourage you to regard any report of itch from an owner as an urgent situation. Pet owners don't usually share all the ways that a pet's itch is affecting them emotionally, at least without some prompting. We as vets rarely see the actual itching behavior in the clinic. There's just too much going on. So it's not possible for us to really experience how the dog and the owner are really affected at home. Itching is a big deal, and it can have a tremendously negative effect on the quality of life and the bond between family and the pet. We as veterinary professionals are in the perfect position and have the right resources now to do something about it. And that, my friends, is the crux of what Itchy Pet Month is really all about. Third, seize the opportunity to provide an outstanding experience for the pet and their people. That means communicating empathy, providing education about why pets itch and what we're going to do about it, prescribing strategic and reliable treatment plans, and setting proper expectations with a clear follow-up plan. What comes next? Dealing with the COVID situation has made this part more challenging than ever before. We have less, if any, face-to-face time with our clients. Curbside concierge or telemedicine approaches can get it done. It's just important to plan enough time to cover the necessary topics. Be sure to pause frequently and check in for understanding. Written or printed go-home instructions, information, and resources are more important than ever to make sure that our clients understand what's wrong, why we're treating the way we are, and what comes next. Now, I'm repeating myself on the what comes next message, but it is that important. It's critical for happy outcomes with a skin case that people do understand that step. Don't forget to schedule the next follow-up appointment. If your caseloads are heavy and that's a burden due to limited staffing or other factors that we may be dealing with now, consider handling those follow-ups even by phone or telemedicine. I want to touch a little bit on strategic treatment options as well. There was a time not that long ago when managing skin cases was intimidating, and we had to talk a lot about safety and efficacy trade-offs. The really safe treatments like antihistamines just do not work very reliably. The ones that did work, namely steroids, have side effects that were always a concern. Now that we have a better understanding of the itch cycle and innovative treatment options like Apoquel and Cytopoint, we can manage itchy patients with confidence. We can even tailor therapy to fit a patient's specific needs, and there's much more certainty and, I would argue, fun in treating dermatology cases than ever before. Prior to Apoquel, I found food trials extremely challenging. Now that I have an effective medication to manage itch that has essentially an off-on feature, I find it much easier to get pet owners through that 6 or 8 week food trial period successfully. For patients where consistent therapy is necessary, but compliance can be a challenge, hey, we now have Cytopoint. It truly is the good old days now for dermatology. Pet owners are looking for a solution that's best for their pet. Why waste their precious time and the effort to come see us by prescribing antihistamines that are unlikely to work and that they've likely already even tried, or use a steroid? In my practice, striving to provide an outstanding experience at every single client interaction and focusing on enhanced dermatology services has made a big difference for us. 6 short years ago, it was just me and about 5 nervous employees. Despite the pandemic, we're still growing at a double-digit pace and just hired our 4th full-time doctor. Our commitment to the patient and customer experience, along with working to really up our dermatology game, have made a big difference for us. Remember, skin issues are the #1 reason dogs come to see us. It's wise to be as good as possible in that area. It's absolutely worth your time and effort to refine the way you approach skin cases and to join in on Itchy Pet Month. So hopefully I've piqued your interest to learn more. If I have, so what comes next? I encourage you to go to scienceofstrongerbonds.com and click on the resources tab, or just add the /resources to the end of scienceofstrongerbonds.com. When you get there, you can download the complimentary Itchy Pet Awareness Month toolkit to use in your practice. When you download that, you're going to find in the toolkit tons of good stuff to promote the importance of skin health in your clinic this August. You'll find social media posts, graphics, emails, downloadable posters, and much, much more. So as I wrap up this podcast, I've got two important thank you messages to share. First is Zoetis for the effort and investment it took to make Itchy Pet Month happen, and the continued innovation that we see in medications that help us make a difference in the lives of our patients every day. Most importantly, I want to thank all of my colleagues out there in the vet med world, nurses, assistants, client services, kennel, managements, who'd I forget? Doctors, of course, doctors too. We're all working in the most demanding work environment I've seen in my 26 years of practice, but we're getting it done and we're making a difference. May I be the first to wish you a happy Itchy Pet Awareness Month. Thank you all for what you do in your communities and for your patients. Check out thescienceofstrongerbonds.com. and be safe out there.
Thank you, Dr. Chrisman. What fantastic information. And thank you to Zoetis for sponsoring this podcast, and to all of you for tuning in. If you'd like to find out more about this and other podcasts, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.